Hello everyone, and welcome back to the channel. Today, we're talking about a topic that touches millions of lives, yet is often misunderstood: heart attacks. We all have this classic image in our heads, right? Someone clutching their chest in dramatic pain. But the reality is far more complex and, frankly, far more hidden. What if I told you that a heart attack could feel like the flu, or just a bit of indigestion? What if I told you the real dangers aren't just about surviving the initial event, but about what comes after? In the next 10 minutes, we're going to uncover the hidden dangers of heart attacks, from the silent symptoms that often get missed, to the long-term consequences that can change your life forever. This isn't just about scary statistics, it's about giving you the knowledge to protect yourself and the people you love. So stick around, because what you learn today could literally save a life. First, let's get on the same page. What exactly is a heart attack? Put simply, it's a plumbing problem. Your heart is a muscle, and like any muscle, it needs a constant supply of oxygen-rich blood to function. This blood is delivered through a network of pipes called coronary arteries. A heart attack, or myocardial infarction, happens when one of these arteries becomes blocked, usually by a blood clot that forms on top of a plaque buildup. Think of it like a clog in a pipe. When that flow is cut off, a part of the heart muscle starts to die. The severity of the heart attack depends on how big the blockage is and how long it lasts. Time is muscle, as cardiologists say. The faster you can get that artery opened, the less damage is done. Now, let's talk about the first hidden danger: the symptoms. We've all been conditioned to look for crushing chest pain, often described as an elephant sitting on your chest. And yes, that is a classic symptom, especially for men. But it's not the only one, and this is where things get tricky. Many people, particularly women, older adults, and individuals with diabetes, experience what are called atypical symptoms. These can be incredibly subtle and easy to dismiss. For example, you might feel extreme, unexplained fatigue. Not just "I'm a little tired" fatigue, but a profound exhaustion that makes simple tasks feel impossible. You could also experience shortness of breath, even without any chest discomfort. It might feel like you just can't catch your breath, whether you're resting or doing light activity. Other sneaky signs include pain in your jaw, neck, back, or even in one or both arms. It might not be a sharp pain, but more of a dull ache or pressure. And then there are the symptoms that mimic digestive issues: nausea, vomiting, indigestion, or heartburn-like feelings. Because these signs are so common and can be attributed to so many other things, people often wait too long to seek help, thinking it's just stress or something they ate. This delay is one of the biggest hidden dangers, because every minute that passes means more heart muscle is lost. So, let's say someone recognizes the signs, gets to the hospital, and survives the heart attack. That's the end of the story, right? Far from it. This brings us to the next set of hidden dangers: the long-term consequences. A heart attack is not a one-time event, it's a chronic condition that requires lifelong management. The damage to the heart muscle can be permanent. This damaged tissue turns into a scar, and scar tissue doesn't contract like healthy heart muscle. This can weaken the heart's pumping ability, leading to a serious condition called heart failure. With heart failure, your heart can't pump enough blood to meet your body's needs. This can cause symptoms like persistent fatigue, swelling in your legs and ankles, and severe shortness of breath, dramatically impacting your quality of life. Imagine being unable to walk up a flight of stairs or carry your groceries without getting winded. That's the reality for many heart attack survivors. Another hidden risk is an increased chance of developing arrhythmias, or irregular heartbeats. The scarring from a heart attack can disrupt the heart's electrical system, which is what coordinates your heartbeat. Some arrhythmias are harmless, but others can be life-threatening, increasing the risk of stroke or sudden cardiac arrest. This is why many survivors need to take medication or even have a device like a pacemaker or an implantable cardioverter defibrillator, an ICD, implanted to keep their heart rhythm in check. It's a constant reminder of the event and a source of ongoing medical care. But the dangers aren't just physical. One of the most overlooked consequences of a heart attack is the psychological and emotional toll. Surviving a life-threatening event is traumatic. Many people develop anxiety, depression, or even post-traumatic stress disorder. There's often a profound fear that it could happen again. Every little ache or pain can trigger a wave of panic. This cardiac anxiety can be debilitating. Patients might become afraid to exercise, to travel, or to be alone. This fear can lead to social isolation and a cycle of inactivity that's actually bad for their heart. Depression is also incredibly common, affecting up to 1 in 3 heart attack survivors. It's not just feeling sad, it's a clinical condition that saps your energy and motivation, making it harder to stick with the lifestyle changes and medications that are crucial for recovery. It's so important to recognize that your mental health is just as critical as your physical health during recovery. So, what can we do about all this? Knowledge is power. The first step is prevention. Up to 80% of heart disease is preventable. This means managing your risk factors, keeping your blood pressure and cholesterol in check, not smoking, maintaining a healthy weight, eating a balanced diet rich in fruits and vegetables, and getting regular exercise. It's the advice we've all heard a million times, but it truly is the foundation of heart health. And please, get regular checkups with your doctor to know your numbers. The second step is to not ignore symptoms. If something feels off, even if it's not the classic Hollywood heart attack, get it checked out. It is always better to be safe than sorry. Call for emergency medical help immediately. Don't try to drive yourself to the hospital. Emergency medical services can start treatment on the way, saving precious heart muscle. And finally, for those who have survived a heart attack, recovery is a journey, not a destination. Embrace cardiac rehabilitation. It's a medically supervised program that includes exercise training, education on heart-healthy living, and counseling to reduce stress. It's been proven to reduce the risk of a future heart attack, improve quality of life, and help manage the emotional fallout. And don't be afraid to talk about your feelings. Seek support from your family, friends, a support group, or a mental health professional. Remember, if you are struggling with your mental health, reaching out is a sign of strength. There are resources available, and you don't have to go through it alone. The story of a heart attack doesn't end when you leave the hospital. The hidden dangers, the atypical symptoms, the risk of heart failure and arrhythmias, and the heavy emotional toll are a crucial part of the picture. By understanding these risks, we can be better prepared to prevent heart attacks, recognize them when they happen, and support a full and healthy recovery for ourselves and our loved ones. Thank you so much for watching. I hope this information was helpful and empowering. If you found value in this video, please give it a thumbs up and share it with someone you care about. And don't forget to subscribe and hit that notification bell so you don't miss our future videos on health and wellness. Stay safe, stay informed, and take care of that amazing heart of yours. See you in the next one.